We've all seen the videos. The football player that gets tackled awkwardly, the basketball player that lands on a hyperextended knee, and the soccer player that makes an aggressive cut, all ending with an athlete dropping to the field of play and grabbing their knee. ACL injuries can be overwhelming and downright scary, but with the right rehab and therapy, they're completely manageable and you can and will return to sport. In this video today, we're going to talk a little bit about the types of ACL tears and also help you feel a little bit better and a little bit more prepared for your upcoming ACL surgery. My name is Carrie Heydrich, and I'm a physical therapist at EW Motion Therapy. I've been a licensed physical therapist for over 10 years, and without a doubt, one of the most rewarding injuries that I've had the opportunity to treat is ACL repairs. So today, I want to spend a little bit of time talking about types of ACL tears, risk factors associated with ACL tears, and get you guys ready for your upcoming surgery so that you're more prepared and you're going to be more successful. So typically, ACL tears are usually classified as either partial or complete. A complete ACL tear is just that. The ligament is no longer connecting the tibia to the femur anymore, and we usually see a significant amount of instability. Usually these types of tears require a reconstruction. A partial tear is also just that. There's a small segment that's still connecting the femur to the tibia, and you don't have as much instability as you do have in a complete tear, but there is some. And the treatment required for that is going to be very much dependent on the size of the tear, the age of the athlete that has the tear, their activity level, and how much instability the knee has. ACL injuries can also be graded in their severity. A grade 1 is just that the ligament is stretched and a little bit loose. A grade 2 is that there is a partial tear, and a grade 3 is a complete rupture. ACL injuries can happen for a variety of reasons, but there are some risk factors that can increase an athlete's risk for having one. Female athletes are at an increased risk for having an ACL injury compared to males. One of the reasons is because females have a greater valgus angle at the knee. Another reason is the increased amount of estrogen and progesterone that a female athlete has creates ligament laxity. And a third issue is just decrease in strength in quad, hamstring, and glute that gives less stability to the knee. Another risk factor that can increase an athlete's risk for having an ACL injury is having a recent lower extremity injury, like an ankle sprain or a knee sprain. When an athlete returns to sport maybe just a little bit too soon and they have some compensatory movements that cause increased stress over the knee. Sports that require a lot of cutting, pivoting, jumping, and landing place an athlete at an increased risk for having an ACL injury. Another reason an athlete may be more likely to have an ACL injury is poor biomechanics and technique. I think it's really important to know that just because you might have some of the risk factors that are associated with ACL injuries, it doesn't mean you're going to have one. But being aware allows you to be a little bit more prepared and allows you to make changes so that you can decrease your risk of actually having one. Let's talk a little bit about some of the things that you can do to be very prepared for your ACL surgery. I always tell patients, the better that you are going into your surgery, the better your outcome is always going to be. So the main things that I would really like you guys to think about and focus on before your surgery are making sure that you have as much range of motion as you can, meaning you have as much knee flexion and knee extension, and maintaining as much strength as you possibly can going into your surgery. So things that you guys can do to make sure that you're keeping a good amount of quad strength and hamstring strength would be things like squats, leg press, bridges, quad sets. Things that you guys can do to make sure that you're maintaining good range of motion in your knee would be things like heel slides, hamstring stretch, and knee extension stretch. The other thing that you guys need to do that's going to help with the first two is keeping your swelling down. So things like compression, icing, and elevation are going to be good cues for you prior to your surgery that you can create good habits with so that you can start doing those right after surgery. I hope you guys feel a little bit better about your upcoming surgery. With that being said, physical therapy is a critical portion to your recovery, and picking the right physical therapist who is knowledgeable about ACLs is going to be key in your recovery process, especially if you're trying to return to sport. Click the link in the description below to watch our video, How to Choose the Right Physical Therapist. This video details the key qualities to look for when choosing a physical therapist.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.